Good afternoon, everybody. We'd like to call the meeting to order. Adequate notice of this meeting was provided as is required by the Open Public Meeting Law with advertisement in the Home News Tribune and posting on the bulletin board in the municipal building. The statement will be placed in the minutes of this meeting. Please stand for the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Calling the roll.
Councilmember Slavicek.
Here.
Osceola.
Here.
Bruno. Here. Estrada. Krasuski.
Here.
Perez.
Here.
We're going to have a change in the agenda. Closed session will be after new business. We're not going to do it before the meeting.
Our first order of business is presentation of the shelter plan by Councilmember Pete Krasuski.
I'm sure everybody has a copy of it. If you want to just follow along. As everybody knows, back in November, the shelter was closed due to some health code violations, and we entered into a memo of understanding with the NJSPCA. They brought up some obvious shortfalls in how the shelter was run, just the operation, bookkeeping. There was a whole list of things that were listed as inadequacies. In the past couple of months, with going through what we've gone through, we worked closely with the NJSPCA, with Nicole Dawson, and Nikki was responsible in large part for putting together this plan, which is a repurposing of, or reorganization, I should say, of how this entity will be run, hopefully going forward. The purpose of the plan is for, I'll go through and I'll read just bits and pieces of it, and then I have some things highlighted that I'll just go through, so I don't have to read through 20 pages of this with everybody. The plan will assist the mayor and council in developing a plan for a successful animal shelter. The plan was developed based on organizational data and benchmarking research. There's a whole bunch of other stuff that goes into this with regards to populations of the municipalities we're contracted with, overpopulating of the shelter itself, the amount of municipalities we were contracted with compared to what we could adequately handle and handle with sufficient care for cleanliness and care of the animals. The purpose of this is to have a quality functioning shelter that will add value to the quality of life of the community and be a joint venture between the municipalities we contract with. We have a board, an advisory board that we're going to be appointing at some point in the future, hopefully within the first 2 quarters. So within the first 6 months, to avoid any of the downfalls that we've had in the past. So everything will not be run solely by the mayor and council. We're going to have an advisory board that will help us. That will consist of, we're not sure, we want to have possibly an attorney, some township residents, some members of towns that we're contracted with. So it's not just run internally here. And we want to put the same situations that we've had in the past. The HRAS is a municipal organization that provides animal control shelter services. We currently have 8 contracted municipalities. And the numbers that they had in 2013 and 2014 were approximately 1,800 animals. 2014 was kind of up in the air because the bookkeeping was not really adequate. So we weren't really too sure what those numbers were towards the end. And then it talks in the next one about the NJSPCA doing their takeover. It also says that the quarantine is in effect as of the writing of this, but there is no quarantine in place as of now. The Middlesex County Health Department gave us the okay to open the shelter up. We have to give them a plan to address a couple of different things that we have currently going on in there with regards to the floors up in the cat rooms. But the floors down in the dog runs are all being, they're going to be completed this week, and they will be sufficient for cleaning and not having some of the issues that we had in the past down there. And that was part of the reason why we were shut down. I'll go through some of the key elements. First was the advisory board. The advisory board for the animal shelter is to ensure personal matters are appropriately addressed. If there's something going on that somebody thinks is important but others don't, it's up to the director to take that to the advisory board. And we don't fall into the same situation where the director goes to one particular person up here and is either shot down or none of that information is addressed with all of us. So where you would get one person getting information and now everybody else is dumb, fat, and happy and nobody knows, this will not happen in the future. We'll take every possible action to make sure that it doesn't. The advisory board can assist the shelter with organizational focus, which is that same thing. If we're kind of getting in the wrong direction with some things are not adequately addressed, whether it's budgeting, cleanliness, care for the animals, or whatever it is, that board will help get us back on track as to where we need to be, so that everything and the animals are addressed appropriately. Best practices was something that we spoke about many times in regards to care of the animals, care of the shelter, maintenance of the shelter, maintaining it inside and out. We're going to have a procedure manual written. That's going to be done, at a later date, and it's going to be a work in progress when we hopefully first open the shelter. Volunteers. In the past, we've heard a lot about volunteers not being welcomed into the shelter, turned away when they made suggestions, when they made comments about things that weren't right or being appropriately addressed. The new focus of that is going to be to welcome in volunteers. They will be vetted, and everybody will be, make sure that they're not in there for the wrong purposes, but people will be, they'll be welcome to come in. And I know that there was a lot of interest in the surrounding communities for coming in and helping. And I know a lot of people were turned away, which obviously is not good. The phase 2, phase 1, consists of forming an operational advisory board, hiring qualified shelter manager, director, and additional qualified staff. We are currently in the process of interviewing people. Nothing is in writing as of this point. We're interviewing people to see who best fits with what our focus is going to be going forward for this place. And if somebody comes in with the wrong ideas as to where we think we're going, then we're going to move in a different direction. But right now, that's currently ongoing, and nothing is finalized as of this point. Operational planning to include implementation of quality disease control programs, pre-adoption sterilization, increased adoptions, foster programs, which I don't think we had any of in the past. They basically brought animals in, let them out. If you had, diseases in animals that could have been prevented before because you had no vaccination procedures in place, they're not addressed. And as I think most know, that was, you know, part of the reason why we had some of the issues that we've had. I can't see, I'm sorry, I forgot my glasses, so. Community programs, we want to be more involved, obviously, with the community, and I know that's going to be, in large part, associated with volunteers. Volunteers, it's somewhere in here, it says something about Boy Scouts, Girl Scouts, the schools, so everybody understands. And I think another piece of it, too, that we were talking about is, I think a lot of the younger kids, and I might be wrong, but I think a lot of the younger kids don't realize what it takes. They think just, you know, the shelter is what it is. You know, it's just a place to hold an animal. They don't understand about volunteering until they get a little bit older. So getting the people involved and engaged at a younger age, and that is through all these other programs, which we have never done before, which will be a work in progress once we get back up and running. And when we get to that point, everybody will be encouraged to, you know, give us their suggestions as to different groups and schools, like I said. There was also something about like a wellness clinic, vaccination, you know, clinics, discount rabies, spay neuters, microchipping. If you go to your veterinarian, those things, and I noticed from my own experience, you can pay $450 to get your dog spayed, neutered, microchipped, you know, with other vaccinations. If we can provide them, because part of what we're looking to do here is to be more of a full service thing rather than just be, we'll pick up a dog and then kill it 7 days later. I mean, I know that's kind of harsh, but in some instances, that's what it, you know, that's what it boils down to. So we want to be more of in the communities, and that was what was presented to some of the communities that we met with, was we're going to be more of a full service place where it's not going to just be pick up a dog, throw him in a kennel, and hope that the owner comes to adopt him. So, and part of this was discount microchipping. We would charge somewhere $25, $27 to microchip your dog. If you go to your vet, you're paying $75 to get it done. So if you're in one of our contracted towns, that's one of the benefits that you get. The volunteer program, again, that's, you know, that's going to obviously be a huge part of us. I know a lot of times, you know, the past couple of months when people were coming up, that's what you heard about, was how people were willing to volunteer and help, but were turned away, and, you know, in the future that won't be, hopefully that won't be the case. The mission is to provide a safe and clean environment for all animals, permanent living homes, and there's another part of this with trap, neuter, release that I think a lot of people don't really get don't have any idea about, and I think a lot of times people think it's just you pay all this money, you trap a cat, you neuter it, you release it, and then, you know, it just winds up costing you more money. We had a specialist, and she's actually, I think she's a policy specialist from the state, and she works specifically with trap, neuter, and release. And I know that's one of the biggest things that everybody has an issue with trap, neuter, release, is that it doesn't work. And from what we were provided, at some point we'll make this other piece of it available, but in some cases it'll reduce the amount of cats, feral cats, by 70 or 80%. There was one instance where they had where it was 100% reduction in euthanasia and like a 90% reduction on the intake of cats. They're kind of phased out through attrition. They're not, you know, having 7 litters in one colony, and then, you know, some cats can have 2 litters a year. That stuff, it may happen on occasion, but if it's done correctly, it doesn't happen as much as it does when you're just catching and killing. The next just speaks about our vision that we have, and we'll come up with that. The next is the advisory board that we're going to appoint. It's going to be within the first 6 months. They're going to be basically over the shelter manager, assistant manager. It lists in here the shelter director, and then the org chart as it flows down. The only involvement with the government at this point here is going to be that the advisory, the executive director will report back to us once a month on conditions. Obviously, as anybody, up here should have the right to, we'll pay attention to what happens. If there's something that you hear or you don't like, you go to the shelter director and, and have access to it as we should, not like it's been in the past. Staffing concerns. In the past, we had 21 municipalities, as everybody I'm sure has heard many times. The staff that we had at the shelter, in a lot of ways, was not adequate for what we had, because you have too many shelters, or too many municipalities coming in, and we can't provide adequate services for the shelter and the animals that are in there, which obviously led to what we currently had. So if we have inadequate volunteers, 21 municipalities, inadequate staff, we're not working with rescues, and we don't have any of these quality relationships with any of these other places, whether they're rescues or volunteer programs, then obviously we suffer, which is what it is, and what it has been in the past. I'm just going to kind of skip forward. It gives you some things in here about population and how the animal population is with the appendixes. Like the Appendix A that we have here, we gave to the municipalities that we're contracting with, just to show them the services that you're going to get with regards to the discount, spay and neuter, the microchipping, all of that stuff is lined in this Appendix A. Yeah. I need the second part of it. I don't know what I did. After Appendix A. Yeah, no, no, I had the financial piece. I did do that already. No, I wanted to move on to just the financial piece. Now this is the projection that we have here, that the expense piece of it, which is Appendix D. It goes through all of the all of the pieces of it, the payroll, the health insurance. Some of these numbers, while they may be a little bit off, the difference between running the shelter, and I know that's been one of the things that everybody's been complaining about, that you can never run, you're not going to make $1 million off an animal shelter, it's just a fact. But the way that we have it to bill per capita now, at a $3 per capita, which is on the lower end of kind of in the middle. Some of our other contracts that we were entered into in the past were $2 per capita, $1.36, 74 cents, 81 cents per capita, 15 cents. And when you have these types of per capita costs, there's no way, if you're taking cats and dogs into the shelter, and it's like opening a restaurant and having 20 tables. You can sell all your food at $1 a profit per plate, but at the end of the day, then you need to have 24-hour service just to keep your doors open. And it holds true with this as well. If you're charging an adequate, it's been said on many different occasions, it's a needed function or needed facility in this county. If it's needed, we need a certain amount of money to charge to keep the doors open. Other townships, we're not robbing them, we're not charging them something and putting gold-plated, toilet bowls in there. It's going to be run as a responsible functioning shelter, but at $2 and 80 cents per 80 cents and $1.50 per capita, it's just not possible. So under the new fee structure, will tell you that the towns that we currently have under contract, and as of right now, I'm not 100% sure those are accurate because somebody had said that we lost, I think Plainsboro was, but we never had anything in writing, so I'm just gonna go with what we have. So currently we have $441,000 in contracted fees. If you went off of any of these towns based on what the current contracts were, it was leaps and bounds less than that. And then when you figure in all of our expenses, it's $620,000 just to run it between uniforms, utilities, maintenance, food. We get food donated, so we allocated something in there just to show in case you had some kind of a special need or something special that came up. But basically, these numbers are pretty much in line with where we feel they should be. Adoptions of cats and dogs, we've adjusted we will adjust the rates for the cats and dogs that are adopted. And I myself was kind of ignorant to this as well. I thought $15 to adopt a cat out was people would be, lining up at the door to do that. Until I heard some of the reasons why they don't do it is because they're used for big animals. Because it's not like somebody's just going to come in and adopt an animal for $15 and everybody's going to take it home and put it into a loving home. People do bad things with that, and to prep the animals. I don't know if that was still in here too, but to vaccinate and give out for what it's worth, just a healthy animal, still showed us turning a profit on both cats and dogs. So for a cat, if it costs you between doing your vaccinations, your testing, your deworming, your microchipping, it costs you $88. And if you're paying $100 for a cat, you're still, you're making whatever that is, the $12 or $11 and change on it. And then the dogs, the same things, spay, neuter, heartworm, all that stuff. It's $120, and then there's $250 for an adoption fee. Go to your vet, get your cat, dog, whatever, get them spayed, neutered, chipped, and it's $450. It's not $250. So these numbers, and working through them, we felt like they were adequate numbers. We could have animals moving in and out, which is also another part of what we're going to try and do, is not keep them in here for 6, 8 months, 12 months. Some enrichment programs are in the works that we're planning on instituting, where cats and dogs really are not just put in their pens and left to sit there for 12 hours before somebody even comes in and walks past them. And just in general, from a numbers standpoint, people that that we have hopefully coming on board will be more geared towards making sure that the shelter itself runs more efficiently. And just based off the numbers, we're hoping that it's a viable product for us to put out there for the day. So if anybody has any questions, I don't know if you want to open up to the public yet.
I got a couple.
Sure.
Contracted towns that we have.
Yeah.
It's signed over the new prices or the old?
Nobody has said anything yet. Then if anybody was, but we spoke with a few of them, 6 of them, and they're going back to their council. They understand it. The townships that we contract with understand there's an increased cost, but they also understand that for them to put this service together themselves is going to cost them a lot more than what it costs.
No, I understand that, but we don't have anything in writing yet from them that they put in the prices or anything.
Dave is actually, I think, working on.
Yeah, but there was some confusion there because Dave was getting. We traded emails yesterday, Dave and I, and I had asked Matt to revise the contracts and then get the new contracts so that I could provide them to who we met with before Wednesday. Because at our meeting that we had, I told the municipalities it would be about 2 weeks. And then when I asked Dave for an explanation as to why we didn't have them, he said that I think it was the mayor. I'd asked you for.
The mayor had suggested I write a letter to each town saying we're going to increase the fees to X. Do you accept before we started writing contracts? because she didn't believe that the towns had agreed yet. But I could do whichever the council wants, but I also just need some clarity as to what the fees are changing to, because I know the old contracts had a number of different fees, and I'm not sure if the $3 per capita is replacing all those fees, or whether certain fees are still remaining or not.
Yeah, no, it's gonna be,
Is it just flat?
it's basically, yeah.
Okay.
So if you can, Matt, if you would, like, I don't mind doing a letter first. I mean, and tell me if anybody disagrees here, but I don't mind doing a letter first, but I think a letter and also getting them, because I didn't hear, there wasn't one person that walked out of this meeting saying, you know, that's too much money for me, we can't do it.
Every town was in attendance at the meeting?
There was,
Just 2 towns, right?
no, there was East Brunswick, South Brunswick, there was North Brunswick, Aberdeen, Cranberry, South River, and Aberdeen, I think it was. So,
Right, but we don't have anything definitive from anybody saying that they're going to go along with this.
no, not yet, we have to get the contracts
Get
up.
closer to the microphone.
So we don't have, you're saying we have contracts, but we're going on the old contracts, not the new contracts. So we're right now, we're assuming they're going to go with it, but we really don't know.
Yeah.
Well,
Well, if they tell us, if they walk out, Vinny, then I'm kind of thinking that everybody's
yeah,
gonna
but
walk out.
shouldn't we wait until they tell us?
I don't mind waiting to hear